You are live. I am live, and it is Thursday. Apologize for not going on the air yesterday, but got a little doubt. Just so you know, again, I'm in the process of relocating my family and our four dogs to Florida. We're moving to Tarpon Springs, Florida, effective the end of this month. It will not affect anything at the office. I love to travel. I will be back monthly to be able to sit down live with anyone that does want to come into the office, as well as this telecommunication way. I'm going to continue to do these messages, and I will be able to connect with anybody via Zoom or whatever social media you want to use. So nothing's going to change here. My staff is phenomenal. We've just hired a new girl, and things have improved here. We're going to be doing a lot more actually here at the office. So rest assured, nothing's going to change. I will be accessible 6 days a week without any kind of complications. I don't become accessible on Sundays. It's a day of rest, and I honor that every Sunday. Well, I've been talking for a long time about the pros and cons of this. Do you think this is helping anything? And I've weighed the pros and cons over the last number of months. And do I believe that if it's somebody that has a cough, a flu, an achiness, an obvious problem going on, they should have one of those on? Because we see the commercials where they really exaggerate. Here's what happens when somebody sneezes and it goes, oh, and it travels up to 6 feet. And those little moist droplets that get blown out can be contagious. There is no doubt. Now, would this stop it from getting to you? Well, this is a medical mask that I have here with the multiple layers. And I would have to feel that if you really want that level of protection, it can help. But if you made the decision not to, then it becomes of the utmost importance that you take care of you. I don't believe that I am impenetrable. I don't believe that I can go out and kiss somebody who has coronavirus and not get it. Because I get it. I myself have been working on basic foundations of keeping myself healthy over the last 38 years. And in the last 38 years, one time that I can recall, one time in 38 years, I took a day off because I was sick. It's about 7 or 8 years ago, when I was probably at the highest levels of stress in my life. And it was bad, and it was ugly for one day. I have not gotten the flu. Praise God, I haven't had a cold. Any kind of issues. Occasional sinus thing with pollen season, but overall, I have enough tools to take care of myself. Now, does that mean I could not possibly, in my late 60s, catch coronavirus? That's in God's hands. And I had to make that decision to do this because I'm not a fan of the masks. So if you see me in public in a place that doesn't require a mask, don't get in my face. Just stay away, please. Don't start saying, oh my God, you're the kind of guy that's going to carry this and share it. Because I'm not. I am not going to be a carrier. I am not going to be active. I've been tested twice so far, negative both times. I just did that to quell my physicians. So what about the masks? You're seeing them all over the place. You can buy them on the internet now, and they're trying to make a statement with these things. Well, the University of Arizona in July decided to take a look and say, what's the best and worst materials for masks? So this is an FYI show that you probably need to share with everybody because I haven't seen this anywhere on TV. It's intuitive and scientifically shown, this article says, that wearing a face covering can help reduce the spread of the novel coronavirus that causes COVID-19. Can reduce the spread. Because if you're coughing on somebody, that will stop 80-90% of that. But not all masks are created equal, according to a new University of Arizona-led research. Amanda Wilson, an environmental health science doctoral candidate in the Department of Community, Environment, and Policy in the Melanina Zuckerman College of Public Health, is the lead author in a recent study published in the Journal of Hospital Infection that assessed the ability of a variety of non-traditional mask materials, that's not this, to protect a person from infection. After 30 seconds, so you're around somebody that's coughing, or after 20 minutes of exposure in a highly contaminated environment. You're out to dinner and somebody's sitting shoulder to shoulder with you just a little ways away, and you're there for at least 20 minutes to an hour. How well did that mask protect you? When the researchers compared wearing masks to wearing no protection during 20-minute and 30-second exposures to the virus, they found that infection rates were reduced 24 to 94%. You want to see a big spread? Here's the question. They really don't know, because nobody in medicine believes that we as individuals can protect ourselves, that there's nothing that we can do from a naturopathic standpoint to increase our own immunity. Risk reduction decreased as exposure duration increased. Risk reduction decreased. The risk of you getting it decreased as exposure duration increased. So if you didn't get it in the first 60 seconds to 20 minutes, the risk of you getting it continues to go down and down. And this is in a highly exposed area. N95 masks, which are even more efficient at filtering airborne particles than the N95 mask, are obviously one of the best options. They can reduce the average risk by 94 to 99% for 20-minute or 30-second exposures. But they can be hard to come by, and there are ethical considerations such as leaving those available for medical professionals. Yeah, it's ethical, my butt. The next best option, according to research, are N95 and surgical masks. And perhaps surprisingly, these are highly trained scientists. Vacuum cleaner filters, which can be inserted into filter pockets in cloth masks. The vacuum filters reduced infection rates by 83% for a 30-second exposure, 58% for a 20-minute exposure. And I believe, honestly, I'm not talking for you, I'm talking for me, that I would be able to do better than that by not wearing a mask. But that's me. Of the other non-traditional materials evaluated by the researchers, tea towels, cotton blend fabrics, and antimicrobial pillowcases were the next best protection. Scarves, which I see a lot of people wearing, which reduced infection rate by 44%, only 24% after 20 minutes, and similarly effective cotton t-shirts are only slightly better than wearing nothing at all. So those of you that are using a scarf, some cloth thing, no better than wearing no mask at all. Think about that. We knew that masks work, but we wanted to know how well and compare different materials' effect on health outcomes, said Wilson. Wilson and her team collected data from various studies of mask efficiency and created a computer model to simulate infection rates. They used a computer like you're watching this on to simulate this. Wasn't real, wasn't really tested. None of this has been tested, which is why I go back. Protect yourself. They took various factors into consideration. One big component of risk is how long you're exposed. We compared risk infection of both 30 seconds and 20 minutes of highly contaminated environment. Again, computer simulated. Other conditions that impact risk of infection are the number of people around you, the distance you share, the size of the virus transporting droplets from sneezes, coughs, or even speech is also a very important factor. If you tend to spew, larger, heavier droplets carry the virus drops out into the air faster than the smaller or light ones. So watch how you sneeze. Aerosol size can be affected by humidity. If the air is drier, then aerosol becomes smaller faster. If humidity is higher, the aerosols will stay larger for a longer period of time, dropping out faster. This might sound good at first, but then the aerosols fall on surfaces and the objects become another potential exposure route. Sorry, Doc. No, it didn't. These things will not live on inanimate objects. Study also showed that the more time a person spends in an environment where the virus is present, the less effective a mask becomes. Wow, that's brilliant. This doesn't mean take your mask off after 20 minutes, but it does mean that the mask can't reduce your risk to zero. So wake up. Buffered vitamin C, 2 to 6 grams a day. Vitamin D, at least 5,000 IUs a day. N-acetylcysteine to protect your lungs. The model developed by Wilson and her colleagues included parameters such as inhalation. We took a lot of research in today, put it in a mathematical model and related. Proper use of mask is so important, Wilson says. We're also focusing on mask protection, protecting the wearer, but they're most important to protect others around you if you're infected. Put less virus into the air, you're creating a less contaminated environment. There, I will agree. If you're coughing and you're hacking, put a mask on or stay home. Cut the rates of spread. So what's the best material? The surgical masks, obviously. And we also found out vacuum cleaner filters. I'm astounded that this science gets published. But anyway, tomorrow we're going to take a look at, is there a genetic link between mom and dad and children as far as allergy goes? It's going to be important to look at. Remember, best and worst for masks. If you're coughing and hacking, wear one. Make your decision about other times. And adhere to the companies that are telling you to wear one when you go in. Most grocery stores now, Home Depot, Lowe's, all of those. It's probably going to help. There's no doubt. But again, as this article says, unless you take care of yourself, you could be in a real mess. The number here at the office, 678-228-8900. For those of you listening to this that are in the Peachtree City area, we have an open house here at the office from 12 to 3 this upcoming Saturday. We have some wine and cheese, some teachings. I'm going to go through some of the basics. Brian will be here doing some teachings as well. We're going to have a lot of special prizes, a lot of giveaways, a lot of things for you. 12 to 3 Saturday. Stop in and partake and learn. 678-228-8900. The website, thenutritionshop.net. God bless you, folks. I'll see you back here real soon. Take care.